Dr. Linda Park here. Today I want to talk about periodontal disease and the importance of even becoming aware of it. It's a silent disease and often isn't even noticed until you're past a certain stage in your mouth, because it can sit there for a long time. You can have pocketing and you can have inflammation and bleeding and maybe not notice it just if you're only brushing your teeth. Brushing and flossing can make you more aware of it, because then you notice, oh, when I floss between that tooth, it's bleeding. Why is that? So the prevalence of periodontal disease in the United States has been discovered for people 30 and over. It's prevalent in 42% of the population. If you're over age 65, it's 60% of the population. So it's no small percentage of people that are affected by periodontal disease. So we have a war going on inside of our body, and the blood vessels that surround our teeth and are in our gums travel down through the rest of the body, and it's the same blood system that surrounds your heart, that goes to your brain, your hip, everything. And what we've realized is it's all interconnected. And so that's why it's so important for us to pay attention to this. Really, the mouth can be a canary in the coal mine, and periodontal disease is a canary in the coal mine. There's a war going on in here, and it's important for us to fight it. How do we do that? So visiting your dentist at least twice a year. In my practice, we do periodontal charting. Not everybody likes it, but it happens once a year, and that's when we measure pocket depths for patients. So in a normal healthy mouth, pocket depths may be 2, 3, sometimes 4 millimeters. And if there's no bleeding, then there's no disease. But if there's pocketing of 3, 4, 5, 6s and bleeding, that's indicative that there's disease present. And in a smoker, you're going to have 3s, 4s, 5s, 6s, 7s, sometimes no bleeding. And that's another issue, because smoking actually decreases the vascularity in the mouth, because the mouth is trying to set up a scar to prevent all the damage that's happening from the nicotine and the smoke happening. So it can be deceptive for people that are smokers. Because it's so prevalent, we like to focus on periodontal disease in my practice. And as I said, because it's a canary in the coal mine, we've discovered through research that there are bacteria, several hundreds actually, of bacteria that cause disease in the mouth, and then they're found in various areas in the body. So P. gingivalis, which is a common one in periodontal disease and inflammation in the mouth, has been associated with Alzheimer's disease because it's present in the brains of patients with Alzheimer's. It's also increases the risk for cardiovascular disease. It actually speeds up the pathologic processes that happen during atherosclerosis. So there's a concept with periodontal disease known as bacteria and cytokine translocation. Those are big words, but what it really means is the bacteria in your mouth are throughout the rest of the body. And while we can't say that it causes problems like coronary heart disease, stroke, atherosclerosis, preterm birth weight, adverse pregnancy outcomes, cardiovascular disease, pulmonary disease, respiratory infections, diabetes, cancer, systemic inflammation, metabolic syndrome, which is diabetes, rheumatoid arthritis, all sorts of things, Alzheimer's disease, chronic obstructive sleep apnea, and COVID-19 complications. Many, many things can be associated with this because, as I said, the bacteria are traveling from here to everywhere else and wreaking havoc on the system. So the canary in the coal mine has to be addressed. The war has to be fought in the mouth because that will reduce outcomes everywhere else. Periodontal disease is going to be found first in the mouth many years before any of these other things happen, like heart attack or stroke or Alzheimer's or dementia or any of these things. And so if we can target things in the mouth, that's why we at my practice, in my dental office and practices throughout the country, heavily focus on people having a healthy dentition, healthy gums, healthy bone, and all those things because of the contributory factors everywhere else in the mouth. These bacteria colonize and create a biofilm. And this biofilm is basically like a slime that kind of adheres to your tooth. And as it stays there, sometimes because of mouth breathing, because mouth breathing dries it out, and people will come into my office and they'll have lots of tartar on their teeth. Well, I brush my teeth every day and I'm flossing. If you tend to create calcification of these things, you get this hotel of bacteria that are on your teeth, and the only way to get it off is for us to remove it. But that's how the bacteria create this slime. It produces lactic acid, and that sets up the whole immune response. And that immune response is inflammation, which causes bleeding. And bleeding is actually a good sign that there's a problem that we need to address and to fight this war in a healthy way. So we train you at the office by brushing, flossing, proper care, and proper mouth posture. All these things to help create a healthy environment for your teeth so that you can have a healthier body. Thank you so much for taking time to watch this video. I hope you found it helpful and informative for living a healthier life. If you did, hit like and subscribe and wait for more great content.